Welcome back to the Collender Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Collender, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms and downtown Detroit. Dr. Collender is here with us discussing his concierge practice and how to avoid heart attack and stroke, and how to begin the reversal of artery disease. Now, Dr. Collender, you were talking about cholesterol in the last segment and telling us that HDL is your good cholesterol and that you can't rely on having that count as being the only thing we have to worry about. Tell us about what is LDL now?
So, Anne-Marie, thanks. LDL is considered your bad cholesterol, whereas, remember we said HDL is your good cholesterol, and I want to just drive home the point at the beginning of the segment that if you've been told you have a high HDL and you have nothing to worry about, that just isn't true. You need a personalized approach, and that statement does not apply to everybody. LDL is your bad cholesterol. So what makes LDL bad is what size it is. And if you have small LDLs, those are the ones that get stuck in the artery and generate a plaque. And plaques rupture and cause clots to form, which is what cause heart attacks or strokes. So I just said a lot. If you haven't listened to the show before, if you've been a listener, you kind of understand a little bit that blockages, or the term we've all been throwing around our whole lives about our arteries, blockages don't cause heart attacks and strokes, but blockages do. Sorry, blood clots do. Thank you.
Right.
Blood clots do. So blood clots are caused when cholesterol is deposited into your artery via bad LDLs and other bad lipid particles that generate inflammation in your arteries. The inflammation causes the plaque process to rupture and you have a clot and then an unforeseen event.
So the cholesterol is causing the plaque?
Well, inflammation is causing a milieu or an environment within the lining of your artery that allows the cholesterol particles to get irritated and take part in this process where plaque is made. So just to back up, I know there's more questions. Some cholesterols are inflammatory, but LDL, even though it's considered the bad cholesterol, LDL is not inflammatory until it enters an inflammatory environment. So the inflammation's already going on, and this gets us back to, what's causing heart attacks and strokes? It's inflammation. It's not cholesterol on its own. It's not blood pressure on its own. Inflammation of your arteries is caused by many things. There are many root causes of inflammation and root causes of heart disease. Cholesterol, and LDL specifically, enters your wall of your artery and becomes inflamed in that environment. So we're not going to talk about every root cause. I see Anne-Marie getting ready to ask me that question.
Right.
But the root cause we're talking about today is cholesterol. That's the root cause we're going to talk about today. And I want to, again, dispel the myths that are out there that you all hear. So we already dispelled that a good HDL means you're safe forever. Now I want to dispel the myth that a low LDL, that my LDL is good, means I'm safe forever. And that's not true either. Many people, well, let me back up a little bit. When the research studies were being done on cholesterol and statin use and whether statins prevent heart attacks or strokes, they tested people in those studies who had low LDLs and good cholesterols. So when they test people, that means they take a group of people with good cholesterol and they give some the medicine, the statin, and they give some a sugar pill. They found that people with good cholesterols also had heart disease. Well, why would you have heart disease if you have a good cholesterol? The reason is LDL is not the marker to follow. It's not the marker that predicts heart risk and heart events. There are other lipid particles that are better at identifying risk. And now I'm going to ask Anne-Marie's next question for her, Well, why are we checking LDLs if
No.
it doesn't measure risk? Sorry, go
Okay,
ahead.
well,
Ask the question.
the question that I have here is, as a patient going to see a doctor, and they start off with blood tests, and they're always very hyper interested in cholesterol and the HDL and the LDL, and you're saying it's okay, it's HDL is the good cholesterol, but the bad one doesn't do you any good in predicting. Anyway, why do we have to be worried about cholesterol numbers as far as how it pertains to heart risk?
Well, cholesterol is one of the most important root causes of heart disease, so it needs to be followed and managed as a root cause. Sometimes our best treatment for this root cause is eat healthier and exercise, get more sleep, manage your stress, and have a home life. Have people around you that care about you. That whole lifestyle helps reduce your risk for heart disease. So cholesterol is an important root cause, so we need to pay attention to it. The problem with the system, and you're asking why are people concerned about it, they should be concerned about it because it's the wrong thing to look at, which is all anyone's looking at when you
Why
go
are
to...
doctors looking at it then?
Because they're stuck in a system that's broken. The system is utilizing a formula that has just 5 or 6 variables. Some of them are fixed, meaning how old are you and what sex are you, and it pumps out a risk percentage, and based on those numbers, you get put on a drug for cholesterol or not. What I'm saying is, we already established in prior episodes that that system doesn't work. Heart attack and stroke is still the #1 cause of death in our country. Despite all the money that's spent on healthcare, that fact has not changed. So we need to look at different things, and I'm educating the audience, our listener audience right now on what they need to take back to their doctor and go, hey doc, how come you're not checking my ApoB, which is ApoB, which is the best lipid marker for identifying risk for stroke. Not LDL, not HDL, but that's all anyone cares about out in the world because that's all anybody knows. They're not studying prevention the way I am, and they're not learning unless you recognize, hey, the system's broken, what I'm doing isn't working, I gotta learn a little more. You're not doing it. You need to become a personalized healthcare doctor. I'm gonna throw a plug out. I became an affiliate of MDVIP, which is a national company that promotes personalized healthcare. They provide an infrastructure for me to provide this kind of care. So I have time to go over all this. Like here we have Anne-Marie, we're talking on the radio, we've talked 20 minutes almost. We haven't gotten past HDL and LDL. I've got like 30 other lipid particles to talk about, and we haven't gotten anywhere because we need to, look how much time you need, and you're a expert medical journalist and you don't know this stuff.
Right.
Patients need time with their doctor to understand what's going on, and we need to spend that time together.
Well, here's my question. So the patient population out there who goes for their regular physical and they get their blood drawn and they find out about what their HDL and their LDL is, and those are numbers that you predict or don't predict cardiac risk. How many of the primary care physicians are doing this ApoB test?
Very few.
Why?
Because they don't know about it. And it's
How
not,
do they not know about it? They went to medical school.
Well, because the current system is not paying them. I don't mean to be this cynical, but they're not being paid to do prevention. All this takes time. They don't have time. They've got 5 minutes. I spend an hour and a half with patients. So they got 5 minutes. You don't have time to do all this stuff. Again, we're looking at many root causes, 15 to 20 in a person, and we're still talking about cholesterol. We're not even getting anywhere this hour, I'm realizing, in educating people.
Yeah,
so
but we're also talking right here about a simple blood test and what can be done
I
with
don't
a
know
simple
why
blood
people
test.
aren't doing it.
All right. We'll have to come back to that because right now we're going to have to take a quick break. In the meantime, you're listening to the Collender Medical Radio Show. You can reach Dr. Brian Collender by calling 248-737-0091. Again, that number is 248-737-0091. You're listening to the Collender Medical Radio Show on News Talk 760 WJR.